about the hepatitis C burden in the country?
Yeah, hepatitis C is a common problem in India. In fact, if you do the blood screening of all normal healthy donors who come to donate their blood in India, 1% of the population will be positive for hepatitis C. If you go by the enormity of the Indian population, we estimate that there will be about 17 million people suffering from hepatitis C in India alone. And unfortunately, majority of these unfortunate individuals do not even know that they are suffering from hepatitis C till the disease is advanced and not in a manageable state.
Tell me, this new oral drug treatment, how is it better than the previous injection therapy?
Problem with previous injection therapy was, as we again showed in our recent publication of analysis of about 770 patients from Ganga hospital, that if you take as a group of all patients of hepatitis C, only 130 could be treated with drugs which were available till recently, of which only 114 out of 777 patients could complete the therapy. And even those who would complete the therapy, the response rate was to the tune of 70%. That means out of the 770 patients which could have been given antiviral drugs, it was effective only in about 14% of the patients. That was the scenario till about few months back. But thanks to this upcoming new oral antiviral drugs, we believe that 80 to 90% of the times, if we diagnose the disease early and screen them at the appropriate time, we may be able to make a big dent in treatment of hepatitis C, and we may be aiming ultimately at the same level as in US, that we should be able to eradicate hepatitis C sooner or later.
Okay, and what is the hope for these patients? How do they stand to benefit even financially?
You know, the cost of the medicine which was available only in US till about a year back was exorbitant. One single tablet will cost you $1,000 US. That was about 60,000 rupees a day. But thanks to Indian companies, thanks to generic manufacturers, and thanks to DGCI and Government of India, now we are able to have the same therapy of 3 to 6 months for a period of about 60,000 to 1 lakh Indian rupees. So it's almost at 1% of the cost which was available till about a year back in US. The previous therapy would cost you anywhere about 2.5 to 5 lakh rupees over a period of 6 months. Currently available therapy will cost you about 60,000 rupees to 1 lakh. So not only it is more efficacious, it is safer, it can be given in larger number of the patient, and there is a substantial reduction of the cost. I think it is a win-win situation for everybody.
Do you see costs further coming down in the future?
I think it is cost because of the competition. Cost is already at the brink, and because of stiff and fierce competition amongst the competitive Indian drug manufacturers, cost is almost at its lowest ebb. And I am told by one of the company manufacturers that they are almost selling it at the manufacturing cost. So 10,000 rupees a course in a month is for a period of 3 to 6 months. I think it is pretty reasonable.